Hi, my name is SherryPacheco, and my speech is on the legalization of medical marijuana. Marijuana has been around for years as a recreational drug. The sale and use of it had been illegal up until recently. I believe that marijuana should be legalized for the medical benefits, not for recreational use. If it were legalized as a medicine, we could have government control just as we do with other medicines to ensure quality. The tax dollars alone would help to pay for the quality control. It is naturally grown and therefore a better choice than many prescription medications, and it has numerous medical benefits for cancer patients as well as other illnesses. Currently, marijuana is illegal from a federal standpoint because it is classified as a Schedule I controlled substance. There is no control over quality. The FDA doesn't oversee medical marijuana like it does prescription drugs. Hundreds of marijuana shops have opened up in the city of Colorado Springs alone. If you have a medical marijuana card, which is easy to get, you can go into any local shop and buy it. Each store that sells it has to grow a certain percentage of the plants they sell, so you have no idea what the quality of the drug is that you're buying. Marcel Bonn-Miller, PhD, assistant professor at the University of Pennsylvania Perelman School of Medicine, states, "We did a study last year in which we purchased labeled edible products in California and Washington. Then we sent them to the lab. Few of the products contained anywhere near what they said they did. That's a problem. If marijuana was legalized on a federal level, we could have control over the quality of the products that are grown and sold to ensure that each patient is getting exactly what they are expecting and paying for. The claim is that funding isn't available to control the quality of marijuana, which brings up another point. Legalized marijuana will bring an estimated $140 million in tax revenue in the state of Colorado in 2016. 24 states have approved some form of sale and use of medical marijuana. If each state makes less than half of what Colorado does, who is considered the pioneer, then the tax revenue would be more than enough for the FDA to cover the cost to monitor and regulate sales and production. While quality is an issue, if marijuana is grown and processed in the best way possible, it is a beneficial drug because there aren't the side effects that we have with chemically produced drugs. Marijuana is an herb which contains 60 active ingredients called cannabinoids that are found in the leaves and flowers, the parts that are used to make medicine. The body naturally makes its own form of cannabinoids to regulate pain, so it's not completely foreign to our bodies. The major side effects are limited to overuse or an overdose, which would be less likely if regulated, and the majority of the overuse is in recreational use. If used properly and as prescribed, there are several benefits of medical marijuana. The U.S. Department of Health approved 2 drugs containing a synthetic version of a substance that is present in the marijuana plant, and 1 other drug containing a synthetic substance that acts similarly to compounds from marijuana. The FDA is aware that there is considerable interest in its use to attempt to treat a number of medical conditions, including, for example, glaucoma, AIDS wasting syndrome, neuropathic pain, cancer, multiple sclerosis, chemotherapy-induced nausea, certain seizure disorders, and PTSD. According to the National Cancer Institute, the main active cannabinoid in cannabis is delta-9 THC. Another active cannabinoid is CBD, which may relieve pain, lower inflammation, and decrease anxiety without causing the high of delta-9 THC. While most studies have been done in a lab on mice and rats, lab tests have shown that cannabinoids inhibit tumor growth by causing cell death, blocking cell growth, and blocking the development of blood vessels needed by tumors to grow. Several lab and animal studies have shown that cannabinoids may be able to kill certain types of cancer cells while protecting normal cells. Some of these include breast cancer and colon cancer. In a report titled Marijuana and Medicine, Assessing the Science Base in 1999, the Institute of Medicine states the clear conclusion that scientific evidence indicates the therapeutic effects of cannabinoid drugs for pain relief, control of nausea and vomiting, appetite stimulation, and for seizures. One of the side effects of cancer and other illnesses and treatments is a loss of appetite. Cannabis is known for giving the munchies and therefore increasing appetite. Animal studies have shown that cannabinoids may prevent nerve problems such as pain, numbness, tingling, swelling, and muscle weakness caused by some types of chemotherapy. Cannabinoid receptors found in brain cells may have a role in controlling nausea and vomiting. Animal studies have shown that delta-9, THC, and other cannabinoids may act on cannabinoid receptors to prevent vomiting caused by certain types of chemotherapy. Cannabis has also been found in several studies to relieve epileptic seizures. A form of THC, taken in oil form, not smoked, has been proven to reduce the occurrence of seizures in many patients. I have a friend whose son had up to 200 seizures per week. He wore a helmet all day to protect his head from falling when he had the seizures. He spent at least 3 months out of the year in the hospital with his mom usually until they discovered a form of cannabis in oil form called Charlotte's Web. In the past year, he has gone from taking 11 pills every day to only 5, and he only has 2 to 3 seizures per week. It has completely changed their lives. His parents and thousands of others support the legalization of marijuana because of the effect on seizures. Cannabidiol, or CBD, has been shown in several animal models to increase or decrease anxiety and improve sleep. It has been recommended as a treatment for PTSD in veterans. There are thousands who already support the legalization of marijuana for the medical benefits. 24 states have legalized some form of medical cannabis because its medical benefits have been proven. Hundreds of people have moved to Colorado to use the oil form of marijuana, not smoked form, as a treatment. I would encourage you to vote in favor of the legalization of medical marijuana on a federal level as well as state level so that more studies can be done and the quality of cannabis sold can be ensured. With the legalization, quality could be regulated. Children and adults in every state would benefit by having it readily available because currently you can't buy the medicine and take it to another state where it is legal.